Okay, so the next step in this lateral part of the knee is looking at actually releasing the lateral retinaculum. Okay, so we've already targeted these trigger points here in the vastus lateralis. Now it's time for us to come down and pick up this lateral retinaculum. Now, as I've mentioned, it's so important that we release all of these lateral structures here so we can allow that balance between that vastus medialis and vastus lateralis. Now, this is a technique that I've developed over a period of time, and it works an absolute treat for releasing the fascia of the lateral part of the knee. So I'm going to pick up the edge of the patella itself, and then I'm going to drag all the tissue down until it won't go any further. Now I know that I'm engaged onto that fascia, especially that lateral retinaculum, and I'm just going to put a really broad pressure through our thumbs down and along and over the condyles. Okay, come down a little bit further. Same again, take the laxity out, be purposeful, push all the way through and just really open up that lateral retinaculum. And you can work your way all the way down through this lateral part of the knee. Okay, so if you haven't done this before, keep in mind that if you put too much cream on this area here, then you might be slipping and not engaging properly, so that's not ideal. So just the right amount of cream or lotion through that area. Probably use the cream more than the lotion. All right, now we do have two trigger points, okay? One in basically the superior tendon of the patella, and then one in the infrapatellar tendon. So these are also awesome little trigger points as well, especially for releasing a lot of these patellar issues as well. So what we're going to do is I'm going to bring my hand underneath, okay, the thigh itself, and then I'm going to come across the top here, and then I'm basically just going to lock straight down over onto that, basically the superior patella tendon, okay, and there's a trigger point just nestled in that area there. Now once again, this is a digital ischemic pressure again, so once again it's one of those techniques where we're just waiting for the trigger point to dissipate, and we're waiting for that sort of release technique as well. So we sit on there. Sometimes it might take maybe 2. If it's someone who's not really had it done before, it might take 3 minutes. So obviously you want to be in a position that you're actually quite comfortable, like any of these release type techniques, working with the body. So if you push too hard, you're not going to get the release, because obviously people are going to fight against you, okay? So there's the supra. If we come down, there's another one here into that infra, okay? So we're going to come down, lock down onto that, okay, like so. And once again, we're just going to wait for that to dissipate there as well, okay? So infra and obviously the supra, and releasing the lateral retinaculum.